Hello and welcome to Say Hi to the Future, Ingenious Thinkers, a podcast aimed at highlighting the human side of ingenuity. My name is Ken Tencer, curator of Say Hi to the Future, helping leaders think differently in the face of uncertainty and ambiguity. Better thinking, better outcomes. With me today are Farah Meghji and Marsiglio, co-founders of Unum. Farah Meghji and Marsiglio of Unum, welcome to Say Hi to the Future.
Thank you. Thanks for having us.
Yeah, thank you. We're really honored to be on your podcast.
Well, thanks for joining us, and congratulations on the launch. So Farah, why don't you tell us a little bit about Unum and starting with how you and Megan met and what went into creating the company?
Yeah, well, thanks, Ken, and thanks again for having us here. So Megan and I met about 5 years ago when I was at Roche doing some work on trying to understand patient experiences in IBD, which is inflammatory bowel disease. I came across Megan's story, and at the time, she helped us understand her own journey as well as lived experience with IBD. And she helped us really connect with other women in Canada. And so through that process, I really saw that Megan was really passionate about her patient experiences. From that point on, we met regularly over the years to really share business ideas, brainstorm. And late last year, we got more serious about it. I have about 15 years of experience in the pharma industry, and Megan's been in patient advocacy and patient public affairs for that long as well. So from our experiences and our expertise, we saw that there's such an interest as well as a genuine desire from companies to really be patient-centric. But what we found, Ken, was that many companies don't really know how to take that concept and translate it into clear actions. So that's really where Unum comes in, where we're really bridging that gap between companies who are creating products and services for patients and the patients themselves. So we help make patient experiences accessible.
And Megan, does that start with helping people understand what patient centricity means? Because it seems like it's a wonderful blanket, but even myself as a patient, I'm not really sure what I'm supposed to expect.
Yeah, absolutely. Patient centricity is definitely a trending word. It's a buzzword right now. And the term patient centricity is very synonymous to customer centricity, which is putting customers at the center of everything. Patients are customers. We're all patients in some aspect, and we're the end users of everything that relates to healthcare. If you put patients at the center of important decision making, it impacts patients at the end of the day. When you look at patient centricity, it's about listening and learning from the patient. It's about better innovating products and services. And yeah, we're seeing the benefits when patients are involved early on in decision making, because it's building trust with patients, which results in a better brand perception from an organization. It increases customer satisfaction, which leads to higher adoption rates. And incorporating patient feedback early on in the design process saves time and money, because you're not having to go back to the drawing board midway if you just include the patient and start talking to the patient right from the start. And all this to say, including the patient results in positive financial and cost efficiencies for companies who are innovating alongside patients. It's also safe to say that social media is playing a big positive role in the uptick of patient centricity, because patients are sharing their stories, people are listening, patients are feeling empowered to speak up. And that's capturing the attention of people in leadership positions, those who are making decisions. They're not just numbers. Patients aren't just numbers. Patients are customers. Customers are people. And people have opinions, ideas, and voices that need to be heard.
Farah, when I listen to what Megan's saying, one, can you clarify patients? Are we talking about hospitals, so patients in the public realm? Is it also private or?
Yeah, it's a great question, Ken. I think that when we talk about patients, we're talking about patients who primarily have either a chronic illness or that they're on a disease journey. But what Megan said is we are all patients in some sense. Perhaps if we're not today, we still have something to gain from patient centricity. We still might anticipate that the solutions that are being created might one day impact us or our loved ones. So I think that, even if we're not ourselves experiencing a chronic illness, for example, or a rare disease, we're still part of this. We still have a stake in the game.
And also, just to add on to what Farah said, sometimes we see patients, like Farah said, that we think patients have a chronic illness or a disease, but you can be a patient when you go to the dentist. You're a patient when you access alternative healthcare treatments, like maybe you go to the chiropractor. You're even a patient if you go get a massage. Like there's so many elements to being a patient. It's not just because you have a chronic illness or a disease. You're a patient when you walk into a pharmacy.
But there are differences. I mean, when I'm listening to that, I've been in business a long time, my own businesses. You build up this whole notion of customer centricity, and you build the costs into the journey that your customers have when they engage with your company. So now I go to, and pharmacies are private, they're privately owned, etc. So I understand that journey, that patient journey. When I go into the public realm, and I've been a patient more than I would want to because of some ongoing issues, I wonder, I don't want to wait 8 hours, 4 hours, 2 hours. I want everybody to be happy and unstressed. But now you're going to raise my taxes 20%, and I'm going to go out of my mind. So is it about the financial, or what is the real discussion here?
Yeah, it's a great question, Ken. I think that, when we talk about the system, the healthcare system, and we think about, you listed one example there, which is wait times. I think that when we talk about our public system, yes, it's expensive to maintain a system that we have, like the one we have in Canada. And when we talk about how to reconcile that with being patient-centric, it's really about how can we help to change the mindsets and behaviors of the people in the system, and less about how do we spend more money or how do we, build new infrastructure or new programs and services. I think that where this really starts is it starts with conversations. It starts with empathy. It starts with understanding the perspectives and experiences of patients as well as providers, so that we're helping really to improve the types of conversations that are happening. We're helping to improve the dialogue between patients and providers. And I'm sure you can relate to this, but when we as patients see ourselves represented in the system, we trust the system, we open up more, we benefit from the system, and ultimately that improves outcomes in the long run.
So Megan, let's build on that a bit. I mean, what I heard and what I read before, we can start by changing the mindset of those within it. How do you actually go about changing mindset? Like, what is the process? What have you found through research that you're applying now?
Yeah, well, it's working with and speaking to people that are in leadership positions that make decisions and providing workshops and training on how to best involve patients in their design processes.
What's sort of the output though? I mean, because again, I'm trying to look for that crunchy, this is what we've seen, this is what we brought them through, and these are sort of the outputs to the patient that we're seeing.
So yeah, and perhaps I can give you a couple of examples when it comes to the drug development process, for example. So, when we include patients in as early as the design of clinical trials, we see that through the drug development cycle, not only are we building clinical trials that are evaluating outputs and outcomes that matter to patients, but we're also seeing impact in fewer amendments to the trial design, better recruitment of patients in that study.
Okay.
And that's really translating into shortened time for those products to come to market, and the demand really from a patient perspective, in that we're measuring things that matter to patients because we've asked them, so we know. And then it becomes more of this cycle where we're creating programs and products and services that we know are going to impact patients because we understand their experiences.
Thank you for that. And let's take that and build again on, another part of the conversation we touched on, which is, why is it a trending topic? Is this something that just sort of surprised us, that patient care is declining, or has been so stressed, possibly, coming out of COVID and the pandemic? Like, how did this move from just every day, got to go and sit and wait, to no, this really doesn't have to be this way?
I think it's a great point. I think a few factors have played into, the rise of patient centricity. I think firstly, as Megan alluded to earlier, social media and, the ability of patients to have choices, to have voices, to share their voices in their journey and with their lived experiences. The second, I think, is that we're seeing data now and evidence to show that when we include patients in processes, in decision making earlier on, our programs and services are better and they're more utilized. Patients are more adherent, for example. And I think the third piece is that we're seeing, in the external environment, we're seeing this shift also from regulators, from policymakers, to really include patient experiences and patient voices when they're evaluating health technologies, and when they're creating drug policies. So I think and also, in that post-COVID environment, we're really seeing the impact of all of these forces like working together.
And do you see a difference, either of you, do you see a difference between private and public? Because you did mention before pharmacies, and you can wait in line, you can wait on the phone, you can, your prescription could be expired if you phone the wrong place at the wrong time. So are you seeing this interest from both public and private, and an adoption by both?
I think for sure in the public sector, we're seeing it more. We're seeing, hospitals and other public health care institutions creating patient advisory councils. We're seeing the addition of those kinds of patient and family councils and patients being involved from that perspective. And then on the private side, we're seeing, for example, pharmaceutical, biotech, health technology companies that are really now starting to ask for patients to be part of their decision making, patients to be at the table. And I think, some organizations and some companies that we've seen and that we've had engagement with are kind of getting to the last mile of a solution, a healthcare solution, and then realizing that perhaps if we talk to patients, now we might have to go back and do things differently. And maybe we fell in love with solutions, and now we get to the point of actually launching those things and we realize maybe we actually solved for something that might not matter as much to patients. So how do we integrate those voices and experiences as early as possible?
And isn't it so simple and obvious in hindsight?
Yeah.
Why
Yeah,
don't we speak to the people we're caring for?
It's truly, it seems like it should be such a simple answer. And, a lot of the times decision makers or leadership will turn to doctors thinking that, oh, it's the clinician that we need to speak to. They're the end user. But in actuality, it is the patient. And a lot of the times clinicians, they don't know the full journey of the patient. And that's what we really need to get at. It's the patient is the customer, and we just need to change the way that those conversations are had with patients.
Yeah, I think Ken, you said this, that it seems simple, and it is simple. It's just not always easy to do. So I think it's simple and kind of difficult at the same time.
And it's funny though, Megan, you raise this point about they don't always know our journey or the customer journey. The clinician doesn't. You would think today, when a 5-year-old could track anybody online and know what they had for breakfast, that somehow our records and our journey would be on a phone or on a tablet in front of somebody.
I think there's a long way to go still. Yeah, no, you raised a very good point. And there's just so many regulations and legal that go into that relationship between the clinician and the patient. But there are some cool platforms that are starting to exist and come out.
And what role does culture play, Megan? I mean, in this whole thing, because you've got to want and believe in it before you even bother trying to integrate systems or engage the customer or patient.
Yeah. Well, I mean, culture is important in every aspect, and it's really key when it comes to patient feedback and service improvements, because a culture that values open communication and sees feedback as a gift rather than a criticism, it's more likely to use patient insights and drive that positive change. For organizations to create an environment where patients feel comfortable sharing their experiences, and where healthcare providers and organizations are willing to listen, learn, and adapt from patients, that's when you really get that patient-centric culture. It's just ultimately leading to better trust and collaboration, better outcomes and experiences for everyone involved. And then also, when a healthcare organization preaches that patient centricity culture, the employees within that organization are going to feel more connected to their patients. They're going to understand their mission better, and they're just going to understand the bigger picture of how they can make a difference. And then taking that concept and making it tangible helps with decision-making processes.
And is that something that you work into your own? I mean, the business side of what you're doing and building what you're doing is that litmus test of is the culture ready? Because ultimately, as business people, we can work with those who are open-minded, but if somebody is 10 years away from recognizing, we might not be in business if that's who we keep going after. So, I mean, do you look at those types of things and in scaling your business? Some of the leading indicators of, yes, that organization could or should be more receptive to us?
Yeah, absolutely, Ken. We look at what we've created as the Unum scale, as that real snapshot and point in time assessment of how patient centric is an organization. And like you said, it starts with the mindsets and the beliefs of the leaders within that organization. So that's really the first step in understanding and moving this forward. And then the next is really looking at the functions and the groups that make up that organization. Where are they embedding patient experiences and insights? And then where is there opportunity to do things differently? Where is there opportunity to look at changing a decision, changing a process, so that we can, we're asking ourselves that question: are we doing this because this is the way we've always done things? Or are we doing it truly because we're embedding patient experiences and we anticipate different results?
So I love that. I mean, I love that discussion. And you talked about the Unum scale as driving the description you just provided us. So is this something that you work through with your organizations, or is it an internal, do you sit there and go, hey, red flag, you're not ready for this. Are you going to open up, or like, how does that all work?
Yeah, so it's less about, red flags and looking for, things that companies are doing, not doing well. For example, I think that many companies have the right intent. They have a genuine desire to make this happen and to make this tangible. So I think through our Unum scale, the first piece of that is really looking at the culture, looking at what's happening within the organization, and then helping the company work through the different stages. So working through, what does it look like from a product development perspective? How does patient experience and patient centricity play into the planning, the business planning of the organization? And then how are we looking at how patient centricity is actually working its way into performance? Because and performance not just of the company, but performance of employees as well. Because if we want people to, embed patient centricity, then we want to measure it in a clear way so that we can talk about the impact. Then everybody within that organization needs to feel connected to that. They need to feel that their performance is also being measured on patient centricity. And then once we have those pieces in place, then we can truly look at impact, because, at Unum, we believe so strongly that patient centricity needs to be something that we measure. It needs to be something that we talk about when we talk about the success of a company. Yes, of course, as shareholders, and as a viable business, we care about our sales results. We care about our business outcomes. We also care about patient centricity if it's something that's really important to us.
Yeah, and just to work off of that too, or build off of that, we're not telling companies and organizations like, you're doing this wrong. We're helping improve how you currently work with patients. How can we better integrate patients into your solutions, and challenging organizations on creating better outcomes. So it's not a scale that's, giving all the red flags and saying you're doing the wrong thing. We just want to really help improve systems and innovations.
And I'll say one more thing on that, and that is that, having worked with patients for almost 2 decades, there is this inherent almost desire to contribute as a patient. People and patients want to be a part of the programs and services that they're going to benefit from. And patients want to be involved. They want a voice at the table. They want the opportunity to contribute and share their experiences so that others who may follow have a better experience.
And, I just have to say, when I listen to the two of you speak about Unum and describe it, and Farah, you mentioned that you, as a duo, you actually care about patient experience. As entrepreneurs that are launching, that are scaling, the fact that you are so invested and so passionate in what you're doing is probably or possibly the most important thing that you can have. I mean, as entrepreneurs, if we don't believe in ourselves, certainly nobody else will. So, and I just wanted to bring that out, because the way that the two of you, your backgrounds, how you've seen it, how you've launched it, it's a remarkable testament to things that you should do when you're getting out of the gate. So put that aside for a second.
Thank you so much, Ken. Thank you.
I had to get that off my chest.
Thank you. We're very passionate about it. And this is honestly like a dream come true for both of us, that we're finally doing Unum. We've talked about it for so long, and it doesn't feel like work. Like, we live and breathe it, just like a lot of entrepreneurs do, but we're always talking about it, and we're just so excited about it because we really do see the change that it's going to make, and the people that we can collaborate with, and the patients that we can work with. It's just a really exciting time.
I have one more question that I have to ask. You started the book club by Unum. What inspired you to launch that and make that part of the organization you're building?
Yeah, it's probably one of the things we're most excited about. Part of Unum is about building our community, bringing diverse voices together. And the book club is one of the ways we're doing that. Megan and I are both avid readers, and we've really come to see and learn about all these incredible books that have been written by patient advocates, by physicians, by nurses, and we really want to read them. So we thought that others could benefit from reading with us. And so this concept of a virtual book club was really born from it. And we've created the Unum Patient Collective, which is our community of patients. And so, this is one of the ways that we are uniting voices and bringing people together. So we're excited that even for our first book club, the author is going to join us for the live discussion. So I think both personally, we're super excited about this, and also from a business perspective, we think that it's one of those touch points, like a podcast, like our presence on social media, that's speaking to a different audience. So we're thrilled about it.
And to just allow other people to engage and to collaborate. And it's another platform for people to use their voices. And that's what we're all about at Unum.
Thank you so much, Megan and Farah. It's been a pleasure speaking with you and learning more about Unum. And hey, on behalf of every patient, which we all are, I truly hope that your growth and your scaling and your future is successful, and come back and let us know some of your milestones.
Absolutely.
Thank you so much, Ken.
Thanks for having us. We really appreciate it. We've loved this conversation.